Hello and welcome to this edition of the Israel Homeland Security Special Report. I'm David Jones, and today we have the pleasure of interviewing Professor Pinchas Halpern, Director of the Emergency Department at Tel-Aviv Sourasky Medical Center. Professor Halpern, hello, and thank you for taking the time to be with us. How do you see medical treatment in the combat arena in the next 25 years?
What we see in the combat medical arena now is very rapid changes in technology, which were tested in Afghanistan, Iraq, and so on, which look at three main fields. A, identification and tracking of casualties and their physiological status using technology that is already on the soldier. B, medical treatment of the soldier in the field using evolving medical technologies mainly aimed at stopping bleeding. And thirdly, transportation of such soldiers in a way that makes them arrive safely and alive to the back medical camp.
In the conference, you mentioned there are robotic systems in the combat arena. Could you elaborate on that?
I think there are two things robots can do much better than humans. A, they can carry supplies into combat, thus enhancing the quality and quantity of medical supplies that we can bring into combat. And B, transport patients, casualties back to the medical facility in a way that will be safe and won't endanger the casualty and the soldiers that will need to transport them as well.
Is Israel at the forefront in this field? And if so, how would you explain that?
I think we are. The medical community in Israel has a huge amount of interest and a huge amount of experience, practical experience, in the treatment of combat casualties, terror-related casualties, and also there is a very good technological basis in Israel. The combination of the technological prowess of Israel as a country and the medical system's experience comes together, I think, to allow us to be at the forefront of developing technologies for the medical care of combat casualties.
Speaking philosophically, do you think there's a point where technology hinders rather than helps in this kind of scenario?
It may, but I think it's up to humans to limit where technology is applied, and it's up to us to make sure that technology does not take over the human mind and the human capability to command and control what's going on. And technology always needs to go forward, but needs to be limited and correctly applied by us humans.
Do you think Israeli high-tech companies are investing enough in innovative medical technologies for the combat arena, or is there too much stress on weapon technologies?
I think that it's an evolving field. There are many more companies today than there were in the past. I think they're not nearly enough, and I think they don't always realize the potential of Israeli technology and medical systems to actually go much deeper into this, and I think there's a lot of work to be done.
Professor Halpern, thank you very much for your input. It's very much appreciated. Good day.